Okay, welcome to Roasted Academy. Please like and subscribe to our channel, for this shows how much you support us. Let's continue with our discussion on hypersensitivity reaction, where we saw that there is an exaggerated and an inappropriate immune response that was being posed, okay, to the um, to the antigen. Okay, this can either be self-antigen or non-self-antigen. Remember about that, right? In type 1 hypersensitivity reaction, what did we see? We saw the release of IgE binding to the mast cells after, for the second exposure, and there's degranulation of the mast cells, and then the mast cells are releasing histamine. That's what we saw in type 1 hypersensitivity reaction. Now, type 2 hypersensitivity reaction is also known as cytotoxic type of hypersensitivity reaction. This is the antibody mediated type of hypersensitivity reaction. Okay, so really about the antibodies that are going to be involved, here we've got IgG or IgM. These antibodies bind to antigen on cell surfaces, okay, or extracellular matrix, activating the complement system or also activating the what? The cytotoxic cells. Remember about the complement system that we have got, either the the classical pathway, we have got the alternative pathway, as well as we've got the what? The lectin-mannose binding pathway. Now, if we're dealing with antibodies, meaning that is which pathway that is being activated, it's going to be the classic pathway, okay? The classical pathway. That's one that is mediated by the antibodies. And these antibodies can either be IgG or IgM. Okay, that's about that. So the common examples now, hemolytic type of anemias, okay? Autoimmune hemolytic anemias, one of the examples, where we see that antibodies are binding to our own particular uh, antigens on the red blood cell surface, and then now these red blood cells are being what? Destroyed, hemolysis, destruction of the red blood cells. We also have Goodpasture syndrome, where the glomerular basement membrane is going to be attacked by of the kidneys, okay, by the antibodies. We've got rheumatic fever, we've got myasthenia gravis. This myasthenia gravis, it's where we're going to see that, okay, the acetylcholine receptors. Again, acetylcholine receptors, these are simply receptors that respond to acetylcholine. Normally, what happens? Acetylcholine is supposed to bind to acetylcholine receptors. When they bind to the acetylcholine receptors, now there's contraction of the muscle. Okay. Now, what's happening? These antibodies are against acetylcholine receptors. So acetylcholine receptors can also be known as nicotinic cholinergic type of receptors. That's about that, right? So the mechanism in such a way that antibodies recognize self or foreign antigens. Like I said, we've got self or non-self antigens on the cell surfaces. Now they activate the complement system or antibody-dependent type of cellular toxicity. Target cells are going to be lynced. It's going to lead to tissue damage. That's about the mechanism. So also, not only should you just know about the mechanism or investigations just, you are also supposed to know about how are we going to treat this particular hypersensitivity reactions, okay, anti-hypertensive agents, okay, in the end. So we do a direct Coombs test where we check for autoimmune, where we check for antibodies that are present, antiglomerular basement membrane. We also have the ANA test, anti-nuclear antibody test, okay, anti-acetylcholine receptor test. That's why we're looking for the antibodies that are against acetylcholine receptors. Okay, this is what we call a serum autoantibody test. This is the one. Okay, this is what we call antibody type of mediated type of hypersensitivity reaction. Now let's go to type 3 hypersensitivity reaction. When we say type 3 hypersensitivity reaction, we also mean that this is an immune complex type of mediated type of hypersensitivity reaction. So immune complex mediated type of hypersensitivity reaction. So when we say immune mediated, meaning that we've got antigen antibody complexes that are going to form. Now when they form, they deposit in different tissues, causing all the Like for instance, we've got activation of the complement system, all those effects that we're going to see. Okay. So immune complexes of antigens and antibodies deposit in tissues, activating, for instance, the complement system and attracting inflammatory cells. The common examples here, a classic feature of SLE, systemic lupus erythematosus. Okay, someone who's coming in with it, malarash. Okay, reddishness on the cheeks. That's what you're going to observe. Post-streptococcal glomerulonephritis, rheumatoid arthritis, serum sickness, Arthur's reaction, all these are going to be part of what? Type 3 hypersensitivity reaction, which is simply going to be as also known as immune complex mediated type of hypersensitivity reaction. This is the mechanism. Antigen antibody complexes are going to form in circulation, and then they're going to deposit in different tissues, like we've got in blood vessels, can be in the kidneys, can be glomerulus or joints. Okay. Complement activation is going to attract the neutrophils who are coming to the area, which release enzymes, okay, and reactive oxygen species causing local tissue damage. That's about that. So what are the investigations now that are going to carry out? So we're going to realize that even the investigations that we're carrying out, at least they're a bit different from one of the hypersensitivity reaction based on the mechanism and what is taking place. Okay. Of course, some of them may collide. Okay. But usually, at least we're seeing that they're different from some of the investigations are coming in to be different from one of the positive tracks. So like we are checking for the levels of C3, C4. Okay, we are checking for ANA, which is antibody, anti-nuclear antibody. Okay, renal biopsy, like in case of glomerulonephritis, ESR, and C-reactive protein, which is going to be elevated. This is erythrocyte sedimentation rate. These are markers of inflammation. Okay. Now let's go to the last type of hypersensitivity reaction, which is going to be type 4 hypersensitivity reaction, and it's going to be known as the delayed type of hypersensitivity reaction. It's also called as the cell-mediated type of hypersensitivity reaction. When we say delayed, it means that it takes time for this particular hypersensitivity reaction to occur, as opposed to type 1 hypersensitivity reaction, which occurs just within minutes. Okay. This one, it's the T cell type of hypersensitivity reaction that is going to be there. So what are we saying? T lymphocyte mediated type of hypersensitivity reaction, and this response occurs within a period of 24 to 72 hours after antigen exposure. So common examples like contact dermatitis. This is the one that we have here. Contact dermatitis is under type 4 hypersensitivity reaction. We also have tuberculin skin test reaction. We also have graft versus host disease. Type 1 diabetes is here. Okay, where there is autoimmune destruction of the beta cells of islets of Langerhans that simply would do what? Produce or release what? Insulin. Okay. We also have chronic transplant rejection. It is the mechanism of action. They mean the mechanism that takes place. Sensitized T helper cells. T helper cells have been sensitized. They are going to recognize an antigen and they release cytokines. These are going to recruit macrophages and cytotoxic T cells. Tissue damage is going to occur from inflammation and direct cytotoxicity rather than the antibodies that we see in the other reaction. So now here, one of the best examples also is about TB. We wonder we're doing the tuberculin skin test. Tuberculosis, caused by the Mycobacterium tuberculosis, it's under this particular type of hypersensitivity reaction. So when we're discussing type 4 hypersensitivity reaction, we look at one of the examples as TB. Okay, where we see the T helper cells coming to the area. The T helper cells are activating the macrophages. The macrophages are releasing cytokines. Now, they are simply granulomas that are going to be formed. Okay, that's about what we're going to be seeing in type 4 hypersensitivity reaction. So, like I said, were investigations, tuberculin skin test, the Mantox, okay, biopsy will show T cell infiltration, That's about that, right? Okay, now that's when we put in the drugs now. Okay, drugs are depending on it, they are coming in because of these particular mechanisms that are there, depending on which type of hypersensitivity reaction we are dealing with. Like, so in pharmacology now, that's when I explain this particular mechanism really about what happens, right? But let me just mention the drugs that we are using now. We're using antihistamine because we're blocking the histamine effects. Okay, corticosteroids, we're going to be inhibiting the immune system from responding. Okay, we are lessening the immune response. Okay, mast cell stabilizers, we have got the leukotriene receptor antagonists. Remember that leukotrienes are being produced also during this particular inflammation also. Epinephrine, like we are using immunotherapy where we use antibodies specifically, okay, like where we see the IgE that is being produced. The best example, omalizumab. Okay, thank you so much for watching. Please leave a comment and subscribe to our channel.